So there are a number of things that parents should take into consideration as they're allowing their kids to return to sport. First off, there are clear benefits of physical activity and sports for our youth. In addition to physical health, these include social interaction, leadership, commitment to a team, responsibility, and discipline. Additionally, youth involved in regular physical activity are shown to have lower rates of depression and higher self-esteem, improved sleep, less obesity, less smoking and drug use, and many more positive outcomes. Ultimately, parents should be empowered to make decisions that are right for their children and their family. Considerations for parents enrolling their children in youth sports should include their own child's risk of illness, as well as the risk to other household members, the type of sport and level of close physical interaction required, opportunities within that sport to physically distance during training, and the use of shared equipment, size of team, league rules and regulations, and travel requirements. So different sports have different levels of risk of transmission that must be taken into account when planning for return to sport. Higher risk sports include those that involve close, sustained contact between participants and lack of significant protective barriers. Examples include wrestling, football, rugby, basketball, lacrosse, and competitive cheer. Moderate risk sports include those that involve close, sustained contact, but also can take advantage of protective equipment and separation among players. Those examples include volleyball, baseball, softball, soccer, tennis, gymnastics, ice hockey, and field hockey. Lower risk sports include those that can be done with physical distancing or individually with no sharing of equipment or ability to clean equipment between participants. Those examples include individual track and field events, individual swimming, golf, weightlifting, alpine skiing, sideline cheer, and cross country. Risk reduction tactics should include physical distancing greater than 6 feet when possible, face mask use while on sidelines or not actively participating, hand hygiene, no sharing of water bottles or equipment, regular sanitation of facilities and equipment, training in smaller groups, and limiting travel for competition. There is a potential increased risk of overuse injury during the transition back to sport after this prolonged break due to COVID-19 limitations. Recommendations to decrease this risk include taking an off-season and discouragement of year-round play in the same sport. Diversifying sports will target different muscle groups and avoid repetitive stresses to the body. Encouraging rest and recovery days of at least 1 day per week. Implementing preventative training programs requiring multiple types of exercise such as strength, balance, agility, flexibility, and plyometrics. Adjusting fuel as needed, as in more fuel as you ramp up activity, and prioritizing sleep. These are challenging times, and regular physical activity is more important than ever. Our orthopedic and sports medicine team is here to support you and your young athlete as you navigate these difficult decisions. Please feel free to reach out to learn more.